Hello, hello. Hello, everyone. Happy Tuesday. I hope it is nice wherever you are. I'm in Tennessee and it's been raining, which is nice in my eyes. I'm super excited about this week. We have Quisha here with us.
Everybody, look, I'm trying to find it and share it on my Facebook. That's why I'm looking down here at the
You're
moment.
fine. You're fine. I'll tell you guys a little bit about Quisha. She is the founder and CEO of Is it Umemba Health?
Remember, yes.
Oh, remember. Okay, okay. Where she helps mission-driven organizations turn knowledge into scalable learning tools, and she uses a lot of AI. Um, she has over 20 years of nursing experience. I was looking all through your LinkedIn. I was so impressed by everything that you have, and then of course Nina giving me a little background on you. So I'm super excited to hear about all of the ways that you made these big, complex ideas very simple and actionable for nurses. So I'm excited for everyone to hear your story.
Awesome.
Where are you at right now?
I'm in Dallas. Dallas.
Okay.
Yes, it's actually
Gotcha.
still sunny here. But where are
Yeah.
you? Your internet is kind of, I don't know if it's everybody else, but it's a little lag or a little blur at
Oh,
times.
no. It
Are you
could just be because I have the blur on in the back and I'm like
oh,
moving too much. I tend to do that, so I'll just like stay in one place.
oh,
um, I'm right outside of Nashville.
okay. Okay.
But I just left Austin. I was in Austin. I was in Texas for a couple years. It was
Okay.
very, very hot. I couldn't take it anymore.
Oh my goodness. Yeah, it is hot here, but I'm a Southern girl. I'm from Arkansas. I've been in Texas almost a decade now. So yeah,
Yeah. Well, perfect. Well, I love Dallas. I think it's so fun. I can't wait to go back and visit Texas soon, but when it's like maybe a little cooler, a little later in the year. But I'm so excited that you're here because we have been doing this Career Compass. It's our second series for our lives. And right now we're kind of talking to the people who don't really love bedside, but don't know about entrepreneurship yet. And they're just kind of looking at the in betweens, like the non traditional healthcare or roles in nursing or career alternatives, as we call it. So I know you have a long history of public health nursing, and I just kind of want to know a little bit about your early nursing career.
Yeah, absolutely. So I've been a registered nurse. Oh my goodness, I have to keep up with my son's age. My oldest son is 23, so right at about 20 years. I've been at 19 years. I've been a nurse. So I started out in SICU, did 1 year of that because I thought real nurses go work in the ICU,
Mhm.
and realized very quickly I was obviously not a real nurse because it was not my at all. I thought that the nurses kind of ate their young. You know, everybody knows that saying there. If you're in the nursing field, I thought the surgeons had no bedside manner. It was very much kind of it was just a cutthroat environment. And I realized that I loved engaging with the family a lot more than I thought I would. And so I was a night nurse, meaning I would catch that last visiting hours and then I would have to tell the family, like, oh, it's time for you to leave. It's time for you to go. And so that was really tough
Mhm.
to do. So after a year, I decided this is not it. I went into long-term care nursing. So some people like to say, like, oh, type of nursing home. I worked at the VA for my entire bedside nursing career. And so it was long-term care, working with veterans. Geriatrics is my sweet spot. I love working with
Okay.
geriatrics. Even to this day, like I have a lot of patience when it comes to kids and older people. Adults, not so much, but
The
kids
in
and
between, yeah.
I don't have me and you don't have no patience for us, but you know, older people have a lot of patience for. So I did that for 3.5 years, and I absolutely loved it until I realized that what I was doing in my nursing practice was just patching up. And so, you know, I use diabetes a lot because I'm a certified diabetes care and education specialist. So I use a lot of examples with patients that have diabetes. And so I realized we would get someone that came in with maybe a new lower leg amputation and we patch them, you know, they'd be with us for several weeks. We take care of them, we get them healthy, we give them education, get them strong, you know, give them therapy, and then they'll go home. And then the next year they're coming back in because they just had the other leg removed below the knee.
Mm,
And so,
right.
you know, saw a lot of wounds, saw a lot of different things, got a lot of really great experience, but thought this is not where I want to be. I want to be on the preventative side of medicine. So at that time, I had my associates of nursing, and I went back and got my bachelor's degree in nursing. And I got a position as a clinic coordinator for the endocrinology clinic. And so when I got there, I thought, oh, great, I'll do hormones all day, growth tumors and, different things like that. I got there, and 80% of my clients, patients, sorry, the entrepreneur brain will say clients. I go from patients to clients. But 80% of our patients had diabetes, and that just blew me out of the water. I thought for sure, at that time we were doing a lot of gender change as well. And so we were doing a lot of things with hormones and I just didn't expect there would be so much diabetes. And so started providing a lot of education, started to serve as a backup for the dietitian, for the diabetes educators there, and thought maybe this is something I should look into. And so I ended up putting all my hours together, sitting for the board, becoming certified in diabetes care and education, which used to be called certified diabetes educator or CDE, but it's the same thing. And then I did that for a few years and thought, I really want to get a handle on what's happening on the outside walls of the hospital, because if a patient is lucky, they will go see their doctor for a visit 4 times a year. And so if you are someone that has diabetes, it's good for you to get your A1C checked every 3 months. So that means every quarter, hopefully, if you will go and see your doctor, whether you're controlled or uncontrolled in your management, right?
Right.
And so what I found in doing just hours of coaching and education with clients is they only came to see us, 1%, 2% of their time. So it was really those challenges when they were outside of the clinic walls that they were dealing with on a day-to-day basis that needed to be met. And that could be things like affordability for their medications. That could be things like transportation to even get to the clinic to see the doctor.
Right.
A lot of social issues, housing issues, whether they're staying at, and my patients were primarily older. So it could be, going from being independent to now having to live with a child, or going to, an assisted living facility or something like that. And so I have a physician that was a very good friend of mine. She was also over the endocrinology clinic. And she said, Quisha, I think the MPH degree would favor you very well. And I said, well, what is that? Because I see it behind all the doctors' names, MD, MPH. And she says, a master's in public health, you should look into it. And so I did. I looked into it. I thought, well, I think this actually will complement my skill set and what I'm trying to do as far as preventative nursing and education. And so, yeah, I did that. I want to say I was a quote unquote bedside nurse, and I include clinical years as well, for about 10 years. And then in 2015, I finished school and I moved to Houston to be a chief nurse in the Office of Chronic Disease and Prevention. And that is where my public health journey started.
Oh my gosh. Wow. Well, you got a ton of experience under your belt before you got into that, which is so good, because then you really go into it knowing sorry, I've got these dogs that just came up to me in the middle of you talking. And I'm like,
I just wasn't looking at her. She just actually went out the room. She just came out the room. They are big distractions when you're having meetings and stuff. Yeah.
I know. They both came outside and they're just like wanting attention. Well, that's so awesome. So did you go straight into public health as soon as you graduated with your MPH, or did you take a little more time?
I started working before I graduated. So graduated December. The previous March, I started applying for jobs. I knew immediately I was going to have to leave Arkansas. And so for those of you that are considering public health nursing, I will say this: public health nursing, especially if you go the health department route like I did, does not pay very well. And I realized that if I wanted to make the type of money I needed, I was going to have to leave Arkansas. Also, I worked at the VA, which pays very well, pays nurses very well. And so I knew, one, I was going to have to come in at the top, like senior management or middle management. And then I also knew I was going to have to, we have a technician here. And between my husband and this dog and the guy that's installing our new microwave, I just have to block them out of my.
It's okay. I understand.
Okay, can you hear me? Okay, great. Hopefully that will help a little more. So where was I at? What was I saying, Casey?
You said that you left the VA, which paid very well, and you knew that you would have to go
Yes,
into middle or
yes. And
upper
so
management.
I put in positions in Georgia, which the CDC is there. That was always my ultimate goal. Thank God it ended up not being that. But I put in job applications in Florida, in Georgia, and in Texas. And Texas paid the most. And the health department, again, they needed a chief nurse. They needed a nurse, one, that had a public health degree, two, that was also a certified diabetes care and education specialist. So I was
Wow.
literally a unicorn. And that position had been open for 2 years, right?
Wow.
So I interviewed for that a couple of times. I went down there and won one interview. It's actually when I accepted the position, because they said, well, we can't wait until you graduate in December. We need you to move now. And so here I am, a semester before graduating. I am moving to a city that I've never been to. I rented a house on FaceTime with a realtor. I put my house up for sale in Arkansas. I did my capstone. Like, I did so many things in like 3 or 4 months time. And that was my first introduction to public health. And I have to remind them that quite often, like, I know I've been working as a nurse for a while, but this is my first introduction to public health. So things like writing grants and, technical reports and partnership development and
Yeah.
all that kind of stuff, that was completely, totally new to me, but skills that carry me to this very day in my business that I am
Yeah.
so glad that I have the opportunity to do. And one thing I will say is public health is one of those degrees that you will use absolutely every single skill set that you are taught when you go and get a public health degree.
Gotcha. Well, that's good. I really don't know that much about public health, which is why I was really excited to talk to you, because, I work with people every day that have done all these different things with their nursing degrees, but I really don't hear a whole lot about public health. So when you were doing public health, which you said a lot of your skills transferred, which ones did you feel like transferred the best? Like, what kind of person do you think is good to be in a public health position?
That's such a great question. And honestly, I guess it depends on where you go to work. So I'm going to speak from public health department track. Okay. Because you can work, now you can work in tech with a public health degree, which is something, when I went to school, was people were not doing. Now you can work in pharmaceuticals with a public health degree. A lot of people go into nonprofit, that route. You can work in some areas of healthcare. And let me level set here, because I think what you said is actually a really good point that you brought up. A lot of people don't understand the difference between health or healthcare and public health. And so when we talk about healthcare, we talk about the care primarily of one individual. Your doctor sees one patient at a time. You have your own treatment plan. You have your own medications. Everything is tailored towards you. When I say public health, and it took me about 6 months to not miss nursing for this purpose, but my patient became 77074 or whatever the zip code was, right? So when we say public health, we're talking about the health care or the health of communities. So we're looking at everyone in that community, particularly those that might be vulnerable, or I think it's at risk now. We used to say high risk. And so there's a lot of terminology changes that I'm trying to make sure but it changes all of the time. But looking at those populations, so you're going to, working with a lot of immigrant populations, undocumented, communities of color, those that speak other languages, also the last and the least in a lot of times. And so you're looking at trends in that particular community. Why is this zip code? Why are they getting sicker? Why are there higher incidents of asthma or eczema or whatever in their kids than there are in this particular community that's on the other side of town or across the tracks? So that is the difference between healthcare and public health. And so when you see those billboards and, it's saying, go get your flu shot, like flu vaccines are here, that's someone in public health most of the time that's working on that communication. And so that's what I did. I did a lot. Yes, she said, "Oh,
I know it sounds like research kind of like."
It's a lot of research, right? But it's a lot of program development. So that was my sweet spot. So I did a lot of program development, and within that program and development, particularly training and development, developed a lot of curriculums, developed a lot of programs. And of course, diabetes was my specialty, but I oversaw colorectal cancer program as well. We had smoking cessation programs. We had hypertension programs. We had stress management programs. We had nutrition programs. And so think about developing what that looks like for every single program. So we're talking about the curriculum. We're talking about the structure. We're talking about the partnerships that are involved for those, the resources, the incentives, the marketing efforts, because you have to get people in the door. You have to get people to buy into wanting to participate in getting a flu shot, right? Or using these vouchers at the farmer's market or whatever it is. And so it is one of the most robust, I think, degrees for one. But then when you go and work in public health, especially the health department track, you are working normally for an agency that does not have a big budget, does not have a lot of people, and you learn to be what we know in nursing already, to be resourceful. You learn how to make do with what you have. You learn how to be creative, and you learn how to get the work done. And so I will say that a lot of what I carried over from nursing, because I had to be, think of things on the spot, and, oh, we don't have this particular bandage. Let me put this together, let me throw something together and jerry rig it, right? I had to do the same thing, but just on a much larger scale, right? And maybe I'm dealing with funders or funding. Maybe I'm having to move this budget around to cover this person. Oh, this grant is ending, but I don't want to lose my community health worker. So now let me take some funds from this budget and move it over here. So it was the ultimate preparation for entrepreneurship. I just did not know it until I got burnt out and said, well, hell, if I can do this for them and I'm working 60 hours a week, then certainly I can do this for myself.
Yeah, that sounds super dynamic. So in that career path that you had, you were the CNO. Is that what you said?
Chief nurse.
Chief nurse. Okay.
Chronic disease prevention and management. And so I did that role for 4.5 years again. And I loved it. I always say I loved it till it didn't love me back. And so when you work in those positions, and this can be in corporate as well, it can be in a number of different positions, but I found myself in meetings all day. And then I would go home and I would get my boys settled and I would cook dinner. And then I would open up my laptop at my desk or at the kitchen table. And then I would work till 9, 10, 11, 12 at night, whether, it was writing or responding to emails or whatever. And I did that for just about the entire 4.5 years that I was there. And then afterwards, I went to go work and I took some time off. I mean, I had true burnout. Like I took time off and had to do FMLA and was doing therapy and the whole bit. And there was a dynamic there with, one of my supervisors, and it just became a hostile work environment, in my opinion. And it just was no longer healthy. I'll just say that it just wasn't healthy. And I believe that you're not anywhere to stay. You're just there for a season time. And so my season had run up. And so then I went to go work for Texas, the state of Texas, as a diabetes nurse consultant. So then in that role, I worked with various organizations across the state of Texas, helping them to develop their diabetes programs, troubleshooting, again, program development. That's all I knew, right? So helping them, what is your budget? What are your resources? What's your clientele? Who are you serving? And help them, put the programs together, evaluate the programs, and then incorporate a component of their diabetes program into a virtual diabetes education program. So I was doing virtual pre-COVID, which is why when I started Umemba Health, I started Umemba Health as a virtual consulting agency.
Oh, wow. That's really fabulous too. And it prepared you so much for when everything did go virtual, I guess.
It did. I just wish I had been like 5 years prior, because I was maybe a year, before, and then my business was 6 months old when COVID came. But again, I still had 6 to 12 months, on everybody else when it came to, what are the best platforms to use and what are the best curriculums to use in a virtual environment and what can be taught virtually versus what can't. And how do I take this live training and I convert it in a way that's engaging and interactive? I knew everything from which platforms were HIPAA compliant and required a BAA to, which ones were fairly easy to use. So everything from user experience and all of that. And I would take that information that I was testing and collecting for Umemba Health and then go to my day job at the time at the state, and I would use it as I was providing TA and advising our clients throughout the state.
Wow. Okay, so tell me a little bit about when you started Umemba Health. Like you said, you had burnout. You went to work for the state. When did you decide, like, actually, I'm going to do my own thing? It would be better for me to do this.
So Umemba Health is my third business. I will say that
Oh.
first business, epic fail. I made like $700 for the whole year. Didn't know anything about business. I don't even want to take up our time going into that. The second business was a
Okay. Yeah.
partnership with two other women. One was another nurse in CDE, and then another was she was also a certified diabetes educator, but she was a RD, a registered dietitian. And so we were
Hmm.
doing chronic disease education consulting. Partnerships are a little iffy.
Hmm.
So, priorities are different. My priority was, hey guys, we need to get into the virtual space. I see this trend is coming. We can't drive all over Houston doing these classes. We need to create online courses
Hmm.
and market and sell online courses. I also thought we needed to put a lot more emphasis in our social media and our blogging, and all of that stuff. And that wasn't the priority. And so I removed myself from that position. But then again, I have correct foresight and I'm still in business. I'll say that.
Right.
So anyway, at the state, if you've never worked for a state entity, it is very much slow and antiquated, and you have to go through several layers of approval. And I remember telling my husband, I'm bored out of my mind. Everything I do, I move very fast. I don't
Yeah.
like asking for permission. If I see that there is a gap, I have a solution for it. If there is a
Hmm.
need, I have a way to fix it. And so that's just my personality. And so I told my husband, I said, I'm so bored at work. I'm going to start another business. It's going to be virtual. It can't be this hard to, because at that time, a lot of the organizations that I was consulting with were having so much red tape and
Hmm.
putting a component of their programs in a virtual space. So it could have been a user issue, it might have been a technology issue, certainly a budget issue, and just a security issue, and the list goes on and on. And I said, it can't be this hard to do. So I said,
Yeah.
I'm just going to start it myself. I'll do it. What I learn, I'll take it to work, and I'll use it as I'm working with the clients. And I did that. And so I didn't really make any money first 6 months. Didn't make any money at all. Really, a lot of times it was just my parents or my siblings that were on some of those workshops and webinars. But I was in a R&D. I was in a research and development phase of seeing what works and what doesn't work and how to make it better. And I remember at the 6 month mark, because I told my husband, I was like, once I put $5,000 in this business, if I don't make any money, I got to pivot.
Right.
And and COVID came around the same time, March 2020, that I had become a certified CHW instructor. And I did a training right before we went to Nigeria on holiday, and I did a training, and I made some money on that training. And I thought, you know what? I said, healthcare professionals and public health professionals are always going to need continuing education credits.
Hmm.
You're always going to
For
need
sure.
to be trained on the latest something. And so on the way back, I literally revamped my entire business plan on the entire flight back. I got back to the States. I emailed 5 other colleagues of mine, all consultants, and I said, hey, I want to do a 5-day virtual summit for community health workers. The summit theme is going to be preparing CHWs to respond to the COVID-19 pandemic. Do you have a presentation that you can tailor for CHWs? And all 5 of the ladies said, sure. And I said, can you get it done like yesterday? And they said, yes. And so we put together a 5-day summit in probably 10 days, got the CE accreditation
Wow.
for everything. And I remember telling the ladies, if we get 100 people sign up, we'll be lucky, because I'm the new kid on the block. Nobody really knows me. Nobody knows what this coronavirus is. And of course, we were
Hmm.
just using the information that we had at that time. And so our goal was 100 people, and I got 800 and some people, well, 760 something people that signed up.
Oh
So
my
my
gosh.
email list went from 39, 40 people to almost 1,000 people overnight.
Oh my gosh. That is amazing.
Yeah, and then we just kind of went full circle into training and development. And we've been developing courses, curriculum, and all of that since then. And this year, actually last year, we incorporated AI. And this year, we're actually helping other organizations incorporate AI to scale their learning assets as well.
Oh my gosh, that's such a good, like, specific niche topic, because everyone, like, it's split literally 50-50, like people that love it and utilize it all the time and people that are not sure about it. And I've just noticed, I mean, I'm 30, so I've had technology like my whole life,
Yeah,
but I'm like, you either get with it or you lose it. Like,
that's it.
look at people that don't know how to use a cell phone. Like, you've had 20 years to learn how to use a cell phone, but I don't need this. I don't need this. Now that's the only thing you can do is have a smartphone. So
Yeah.
I'm a huge fan of AI. I'm like, it
I
may
was
take,
not. I was not. I love telling my origin story. I got introduced to it from a colleague of mine. She's also a fellow nurse entrepreneur, and she had a webinar. It was a couple of years ago, and I was appalled. Oh, I am an intellectual. This is cheating. Like, oh my goodness, this is.
yeah.
I didn't think of it from a security standpoint. I didn't think of it from a robots will take over the world standpoint. I just thought this is cheating.
Hmm.
Like, this is because I knew what it took for me to get my degrees and my certifications, right? I know how long it takes for me to create a course, and from the
Hmm.
training needs assessment to a literature review to all the pre-post, the content development, the storyboarding, like all of that. And she said, Quisha, tell me about your parents and their experience with technology. And I was like, my mama can't even, and I know my mama might be watching this too, but I'm gonna say, I was like, my mama, I don't even think my mama know how to use a DVD player. And she's like, you
yeah.
sound like our parents in the 70s. Like, you sound like the older generation who did not want to adopt computers, or were not
Hmm.
interested in learning how to use the internet, right, when it came. And when she
Yeah.
said it, I was like, oh, I don't want to be that. I can't
Hmm.
be one of those. And so probably a month later, I enrolled in an AI consultant certification course. Didn't even think about adding it as a service to my business. I just did not want to be left behind. I
Yeah.
just wanted to know what this is about so that I could position myself and be future ready. And
Hmm.
the way things work, this year, for those of us that are in healthcare and public health, the funding was not where it usually is every year. A lot of the priorities of this administration or the last administration are not the priorities of this administration. And so, in losing a lot of funding and losing, a lot of clients, because of course they don't have the budgets anymore, I said I have to pivot, in a sense, and it's really not a full pivot. I think we still do the same thing. It's just AI powered now, and we've added some AI
Hmm.
services. But yeah, it's great that I positioned myself a couple of years ago to kind of be in this position, because now we're able to provide this expertise to other organizations and entrepreneurs. People keep asking me about the workshops and all that. I'm supposed to still be on maternity leave, but when you work for yourself, it just is how it is. But I'm really excited about sharing this with other entrepreneurs as well, because, and I actually made a video, I hadn't posted it, but somebody sent me a DM like, how are you able to do all the stuff you're able to do? And you have a 10-week-old. I'm like, AI, like, it's
Hmm.
AI. Things that took me 20 hours take me 4 hours. Things that took me an hour take me 5 minutes. It's
Hmm.
AI. And no, it's not cheating. It's supercharging your life, your business, your work, and it just makes sense. And no, it's not perfect, and it will never be perfect. But guess what? It's not going anywhere. So all those
Hmm.
excuses that people have about being fearful of what it might do, and what may happen as a result of using it, fine, don't use it. But when everybody else is passing you by and you're still in the slow lane, we're in the fast
Hmm.
lane, and we're waving at
Yeah.
you, hey, you can't be upset, because we're giving you the
Yeah.
warning. We're giving you the heads up now.
And I think if you don't want to use it, that's okay. But knowing how to use it is important. It's like having a driver's license. If you don't like to drive, that's fine.
That's it.
But
Yeah.
like, you need to have the license, because
You need to
one
have
day
it.
you might need to.
You might need it. You need to know how it works. And also, if you're a parent, you want to know how it works, because your kids are going to use it, and the kids are
Hmm.
being asked to use it in school, right? And so, I love that analogy that you use. You absolutely need to have some kind of basic foundational knowledge of, or AI literacy, the workshops that we offer, to understand what it is, how it works,
Hmm.
how it can be applied in day to day life.
Yeah. So it sounds like you're super busy now. So how do you decide now, since you've, been so successful in business, how do you decide if a client or a project is the right fit for you now? Like,
Oh.
I'm sure you don't take as many. Sorry, that's a little off, but I'm just
No,
curious.
yeah, I was like, oh, I wasn't expecting that question. Not that I was expecting any question, but that's a great question.
Like, you can choose a little
I
bit
will
more
say,
when you.
yeah. The thing is, so everybody goes through a discovery session, right? That's like the first. Of course, you're going to go to my website. You may download something that's going to put you on the email list. But normally during the discovery session, I know if you're going to be receptive to the consulting, if you're going to be open to our recommendations for training. And you're right. We don't have to take everything. I have a personal, I don't want to say I'm bougie, right? But there's a certain number, like I call it a get out of bed number. I don't budge if it's not that number. You know what I mean? I have turned down work before and say, I understand your budget is only 5K or 10K or whatever it is. I can refer you to a colleague of mine that I think would do a great job with this curriculum or with this course or whatever it is. But yeah, it's just not me anymore. I have subcontractors. I have, team that I outsource work to. And so I have to pay other people. We got platforms and tools and technology, and then we got all this AI stuff. So I think for the most part, one, it has to bring me joy. It has to be something that is in my niche that I love to do. I can create courses and curriculum all day. I can present and speak all day long. Those are shooting. And if they come at the right price and it's not a heavy lift, then absolutely. But if it's something that's like I've not done before, case in point, I'm talking to a potential client and we were just talking about, our new AI services and different things we've done. And I told her that we create toolkits as well. And she said, oh, can you create an operational manual for our program? Of course, program development, been there, done that. I don't necessarily want to do that. I can do it, but I don't want to do it. And year one, I was taking everything, right? Year one, year two, you're not turning down money. You want everything you can. I didn't tell her that I didn't want to do it. I didn't tell her that we couldn't do it. I said, absolutely, we can do that for me. I'm going to shoot over some questions. I want you to respond to these questions, and then I'll be able to scope your project a little bit better. So I sent that to her, and then the next minute, I reached out to one of my subcontractors and said, who was a project manager, and said, hey, have you ever done an operational manual before? And she's like, yeah, all the time. I thought so. So if we get this opportunity, I'm going to subcontract with you for you to do this operational manual because it's not something that I want to, I don't have capacity. Right. So that's the great part about having partners, about having subcontractors, being able to outsource work like that. So I'm not going to say I necessarily turn down work. If it's clients that I haven't had a good working relationship with before, and I know the money was not worth it, the juice was not worth the squeeze, then I will turn that down because I know it's going to be a headache. I won't lie. I have one of those clients right now that I should have turned down, that I said I was going to turn down. I went against my better judgment. And I'm biting myself in the butt on it. But it is a lesson that you learn, right? You learn as you go. But for the most part, if it brings me joy, if it's going to be an easy lift, and of course with AI now, so many things are easy lift. And if it comes at the right price, it's definitely something that we'll probably do.
Yeah. Yeah. I'm always curious of that because I know like starting out, I would have, when I started like contract work, even through Nina or whatever, I would be like, do you have anything where I can like supplement my bedside, salary? And she'd be like, sure, you can do this. And it'd be something that I hated. And I would be up all night doing it and like, oh, crap. Why did I agree to this?
I think you almost have to do that.
I agree.
When I went through nursing and when I got out and I thought, oh, I got to go to SICU, I'm going to love it, right? Because I loved ER and all the medical shows and, emergencies and all of that stuff. It wasn't until I got there and did the work that I thought, this is not what I like to do. So I almost think you almost have to do that in the beginning to even understand what brings you joy and the type of work and services and solutions that you even want to provide to your clients.
Yeah, I'm with you 100% on that. Well, thank you for answering that. You had a great answer for it. It just came to mind and I thought,
oh no, I love it. Thank you for keeping me on my toes.
Yeah. Well, I know you have a newborn and I really appreciate you doing this. So I just want to kind of end with giving you a chance to talk about what you're doing, what you're offering, if you have any tips for nurses that are maybe bedside right now and are thinking like this might not be for me, or maybe aren't ready for entrepreneurship but are interested in public health. Like, just kind of closing with whatever you feel led to say.
Yeah, I would say start with the end in mind. Where do you see your life? What do you envision? I'm going to be living half of my life out of the country, 6 months out of the year, and hopefully in the next 5 years, right?
Mm-hmm.
So start with the end in mind. What do you want? Do you want to work 4 hour days? Do you want to work 2 days a week? What does that look like? And what's going to be the quickest way for you to get there? It didn't occur to me until I want to say it was last week. I was meeting with a new partner. And he said, Quisha, how did you go from nursing to public health to training and development to tech now? And I was like, you know what? I don't know. But I do know I was open. And I think one of the things I'm really good is I have really good foresight. Where are the trends going? Oh, I see people are doing online courses. Let me do online courses. Oh, I see
Yeah.
people are doing, AI now. Let me get on AI. So I would say be open to the possibilities. Don't be scared to jump on the trends. And don't think that just because it's not nursing, right? I think that nursing, along with public health, really set me up for what I'm doing now as an entrepreneur, because you have to be nimble with critical thinking skills. You have to be able to adjust. When you come in for a 12-hour shift, it may start smooth sailing and go to hell in 2 hours, and it's chaotic, and they pull one of your techs and you've already down a nurse, and you know how it is. And then
And you get floated, and
you
you're
got
like,
a dementia patient that's throwing his poop across the wall, and you've
yeah.
got to manage all of that, right? And that's what I love about being an entrepreneur. Even though I know what my schedule is, right? I know when I come in, I know what projects are open. I know the deadlines, but it's still like every single day is completely different. But I am up for the challenge because I was a nurse. I'm up for the challenge because
Mm-hmm.
I was a public health nurse, right? So start with the end in mind, be open to the possibilities. And then lastly, I always say this usually on every podcast, and I'm glad I didn't forget it. Find something that you love to do so much that you would do for free, and then figure out a way to charge for it. I
Yeah.
can teach all day long. I can do training, speaking engagements, all of that stuff all day long. And so all I did was figure out a way to charge for something that I already love to do anyway. So those are the
Yeah.
3 things that I'll leave nurses with.
I'm trying to put it up here because that's such good advice, but I can't listen and type at the same time.
I can't either. That's my kryptonite. That is my kryptonite. I cannot do that.
Well, I think that's all great advice. That's really inspiring even to me. I'm still new in this whole thing, learning a lot. Even like lives and stuff have been really uncomfortable for me, and I've been really nervous about this kind of stuff. But I love talking to people. I love helping people, and so I think this is all very inspiring to me as well. Kind of helps me look
Wonderful.
with the end in mind. Um, do you have some projects or some offers or anything you'd like to share?
Yeah, so if you want to learn AI, visit umembahealth.com. I don't know if you can drop that
I
in the
can.
comments there. Yeah, so we are doing now. We actually just launched it 2 months ago. We're doing AI training, consulting, and coaching. So if you are an entrepreneur or small business owner and you want to know how you can supercharge your business, boost productivity, quality, efficiency, creativity, all of those things, follow me. I've got a lot of courses and trainings and workshops coming. We do offer AI office hours. We actually just announced that yesterday. So those are our
Awesome.
1-on-one 60-minute sessions if you want that interactive hands-on. Because, I did some market research, and a lot of business owners said, like, I don't want a course. I don't want to just watch a video. Like, I want hands-on, I want interactive. And so one of the things that I'm really good is hearing what people say they want, what are the issues, and then creating a solution based on that. That's a consultant, right? So we've got
Mhm.
AI office hours, but we've got some free training as well. We've got a free course at Umemba Health Academy, AI Simplified. It's artificial intelligence in plain language. It is pending CPD accreditation. So that's continuous professional development. Every Wednesday at 12, we hold AI literacy workshops. And so if you're interested in learning more about AI, what it looks like, things you can do within your organization with AI, join us for those free workshops as well. And I'm sure there's some other things as well, but if you go to the website, umembahealth.com, it is all there. And if you have any questions or comments for me, please send me an email at quisha@umembahealth.com, and follow us on all social media platforms. And you can also follow me, Quisha Umemba, on all social media platforms as well. And thank you for the
Awesome.
opportunity to share more about public health nursing. Oh, can I plug
Yeah.
my book? I always forget I have a book.
Yeah. Yeah, please do. And I'm going
So
to
I
put
wrote
all
the
this in the comments as well so people can just
excellent,
click and reach
excellent.
you.
So I wrote the first book on public health entrepreneurship. You can find it on Amazon, or you can go to quishaumemba.com/book. The title of the book is Public Health Entrepreneurship: Navigating the Intersection of Purpose and Profit. Yes, we know they don't pay much in public health. That does not mean you have to be broke. Okay. That's all I have for you. Thank you so much. I appreciate the opportunity to talk to you guys today. And I hope I get to come back. This was a lot of fun.
Yes, please do. I would love to have you back and talk more about, AI and all that kind of stuff because I'm still learning a lot about it, even though I feel like I said, I was like born with a phone in my hand. But I think it's super important. And even people who are like, yeah, I use ChatGPT, that's like a 0.1% of what you
Yeah.
can
Yeah.
do.
AI is
So
just not ChatGPT, period.
yeah, yeah. Well, thank you so much. I'll put all your stuff at the bottom. So anyone that is interested in learning more, buying the book, or taking a course or anything like that, it will be easy to reach Quisha. But thank you so much and go enjoy some time with your